Hello, I'm Ben and you're watching The PhD Parent. When it comes to the mental health of mums during the perinatal period, that is during pregnancy and about 1 year following childbirth, there's traditionally been a focus on depression. However, in recent years, there's been a greater focus on anxiety and anxiety disorders, given the recognition that high levels of maternal anxiety can increase the risk of negative outcomes for mum and baby. In the current video, I'll provide a brief overview of each type of anxiety disorder before reviewing research that's looked at the prevalence of anxiety disorders in mums during the perinatal period. In another video, you can check out the link below, I review research investigating treatments for such disorders and provide a brief overview of the treatment approaches. Now, I should point out that the focus in the present video is on anxiety disorders in a general sense. As far as I'm aware, there's not yet any compelling evidence showing that an anxiety disorder emerging during the perinatal period differs greatly from when the same disorder emerges at other times. However, there has been some research investigating this possibility in the context of specific phobias and obsessive compulsive disorder, and you can check out my videos in the link below if you're interested. Another point is that anxiety and anxiety disorders tend to go unnoticed and consequently untreated. Different reasons for this are being put forward. For example, there may be too much pressure on mums to put on a happy face during what's supposed to be a joyful time in life. Or education programs may not do enough to alert mums to the possibility of anxiety problems developing. Or healthcare professionals may not properly screen for such problems. Whatever the reason, it's important to recognize the symptoms of anxiety disorders and to seek help where appropriate. So, people differ in their tendency to experience elevations in anxious mood state. We call this trait anxiety. Trait anxiety tends to be normally distributed within the population, meaning that some people score high in trait anxiety, other people score low in trait anxiety, but most people score somewhere in the middle. So a person can be high in trait anxiety, but not necessarily diagnosed with an anxiety disorder. However, people who are high in trait anxiety are at greater risk of being diagnosed with an anxiety disorder. Now, there are two manuals that clinicians and researchers use to diagnose anxiety disorders. One is the Diagnostic and Statistical Manual, DSM, and the other is the International Classification of Diseases, ICD. Amongst clinicians, use of the DSM and ICD tends to depend upon where you live. For example, the DSM is used more often in the USA and Australia, whereas the ICD is used more throughout Europe. Because I'm an Australian, I tend to use the DSM, so that's what I'm going to discuss in the following. So there are several different anxiety disorders that can be diagnosed. According to the most recent DSM, these include specific phobia, for example, animal blood or injection phobia, social anxiety disorder, panic disorder, agoraphobia, and generalized anxiety disorder. Before moving on, there are two things to mention. First, I've left out two anxiety disorders, separation anxiety disorder and selective mutism, as neither is routinely assessed in studies investigating the prevalence of anxiety disorders during the perinatal period. Second, in previous versions of the DSM, obsessive compulsive disorder, OCD, and post-traumatic stress disorder, PTSD, were classified as anxiety disorders. However, in the new DSM, these are now considered distinct, with each having its own dedicated chapter. Despite these no longer being considered anxiety disorders, I'm still going to address them both in this video. So in the following, I'll provide a very brief overview of each type of anxiety disorder, as well as OCD and PTSD. And I'll start with specific phobia. So a specific phobia is fear or anxiety about a specific thing or situation, where exposure, or even thinking about exposure to the thing or situation, results in high levels of fear or anxiety. Typically, a person with a specific phobia will try to avoid whatever it is they're phobic of. Now, in the context of pregnancy and childbirth, you might see women who are phobic about having blood drawn, having an injection, for example, anesthesia, or giving birth. The latter is called tocophobia and is covered in another video. You can check out the link to that one down below. So now on to social anxiety disorder. So social anxiety disorder is characterized, as you can probably guess, by significant fear or anxiety about being in social interactions or other social situations. Typically, people will be worried that they'll be or are being negatively evaluated by others, or that they might do something to embarrass or humiliate themselves. Again, avoidance is a common feature. This avoidance can be fairly obvious, for example, not going to social events, but it can also be more subtle. For example, wearing sunglasses at a social event to avoid eye contact. So now on to panic disorder. To start this one off, it's necessary to describe a panic attack. So a panic attack is a sudden rush of intense fear or discomfort that hits its max in a couple of minutes and involves at least 4 of the following symptoms: heart palpitations or racing heart, sweatiness, feeling cold or hot, trembling or shakiness, numbness or tingling sensations, pain or discomfort in the chest and or abdomen, feeling dizzy or lightheaded, feeling like you're short of breath and or being choked, feeling like you're outside of your body or that things are not real, thinking that you're going crazy, or thinking that you might die. Now, given the overlap some of these symptoms have with serious physical health problems, in my view, it's important to be evaluated first by a doctor to determine whether an underlying medical condition might be causing the symptoms, before then considering a psychological explanation of the symptoms. Now, panic attacks can be expected. For example, being in a shopping center will trigger a panic attack. Or they can be unexpected. That is, they seem to come out of nowhere. Now, panic disorder is when you've experienced more than one unexpected panic attack, you worry about having another panic attack, and you change your behavior to try and avoid further panic attacks. For example, you stop exercising. So now onto agoraphobia. Now, this is when you experience fear or anxiety in at least two of the following situations: being on public transport, being in an open public place, such as a park, being in an enclosed public place, such as a cafe, standing in line or being in a crowd, or going outside of the house alone. People with agoraphobia are fearful or anxious of these situations because they reckon that escaping them will be hard and or that they might not be able to get help if they were to experience symptoms of panic or some other unpleasant symptoms. Again, avoidance is a significant feature, as people with agoraphobia will typically avoid these situations, or they may need a trusted person to go with them. So now, generalized anxiety disorder. So this is when you experience high levels of worry and anxiety across several different domains. For example, financial, work, health, environment, so on. The worry is usually experienced as hard to control and is associated with at least three of the following symptoms: feeling restless, feeling fatigued, difficulty concentrating, feeling irritable, experiencing muscle tension, or experiencing sleep difficulties. Now moving on to obsessive compulsive disorder. So it probably won't come as a surprise to hear that obsessive compulsive disorder, OCD, involves obsessions or compulsions or both. Obsessions are repetitive thoughts, images, or urges that are unwanted and intrude into your mind. They're often ego dystonic. That is, they're not consistent with the person you are or you want to be. For example, you might see yourself as a peaceful, non-violent person, but have the thought of harming someone. Experiencing these thoughts, images, or urges produces high levels of anxiety or distress, and people usually try to get rid of them, for example, by trying to suppress them or by engaging in a compulsion. According to Bloch, the four most common obsessions concern symmetry, that is, keeping things in strict order or doing something in a highly prescribed way, having inappropriate thoughts or worrying that you'll engage in an inappropriate or prohibited action, for example, hurting yourself or shouting out something offensive, cleaning and contamination, for example, germs, poisons, blood, and finally, hoarding, that is, when you don't want to throw things away. It's worth pointing out that intrusive thoughts are common. For example, Spinella found that about 15% of people without diagnosis of OCD report experiencing the types of obsessions just described. So now into compulsions. These can be behavioral acts, for example, checking things such as PowerPoints or door locks, could be washing your hands or other body parts, or maybe cleaning a room. Compulsions can also be cognitive acts, for example, counting to a certain number, saying a specific phrase in your head, or sometimes praying. A person performs these compulsions following an obsession or because of a rule that they have. The aim of the compulsion is typically to reduce the negative emotion resulting from the obsession, or because the person believes that the compulsion will prevent something bad from happening. Now, OCD is a disorder that's received a fair amount of research attention by investigators interested in perinatal mental health. And I'll review some of that research in another video, and you can check out the link down below. So now onto post-traumatic stress disorder, or PTSD. So the diagnostic criteria for PTSD are quite extensive. There are 24 different criteria across 5 different categories. And as it turns out, there are over 630,000 different combinations of the diagnostic criteria that would result in a diagnosis of PTSD, which is argued to be a bit problematic, but that's another story. So to simplify things, I'll describe the 5 categories and give examples of the criteria within each category as I go. So the first category concerns exposure to actual or potential death, serious injury, or sexual violence. This exposure does not need to have been the result of a traumatic event happening directly to a person. That is, it can be a result of witnessing a traumatic event occur to someone else, hearing about a traumatic event occurring to someone else close to you, for example, a family member or a friend, or through repeated or graphic exposure to the details of a traumatic event. The second category concerns experiencing intrusive symptoms related to a traumatic event. These might be distressing memories, dreams, flashbacks, or high levels of emotional distress when encountering information related to the traumatic event. The third category concerns avoidance of things related to the traumatic event. Now, this might be avoidance of internal reminders, for example, thoughts or memories of the event, or external reminders, for example, places or people. The fourth category concerns adverse changes in thinking or mood. For example, a person might experience negative thoughts about the world is a dangerous place, or negative thoughts about themselves. For example, I'm a horrible person. Or they might experience high levels of negative emotions such as guilt, anger, or fear. Or they might have trouble experiencing positive emotions such as happiness, joy, or love. And finally, the fifth category concerns changes in levels of arousal or how people respond to situations. For example, a person may feel irritable or angry, be constantly on the lookout for danger, have difficulty concentrating, or have difficulty sleeping. So that's it for the different types of anxiety disorders. Now I'm going to move on to the prevalence of anxiety disorders during the perinatal period. And in the following, I'm going to focus on the results of a meta-analysis by Fawcett, which was the most recent one I could find. So Fawcett looked at data from across 26 studies, 19 of which reported estimates of the prevalence of anxiety disorders during pregnancy, and 9 of which reported estimates of the prevalence of anxiety disorders following childbirth. Studies were only included if a structured interview was used to diagnose the presence of an anxiety disorder or disorders based upon either the DSM or ICD diagnostic criteria. The results showed that about 20% of women met diagnostic criteria for at least one anxiety disorder, and about 5% of women met diagnostic criteria for 2 or more anxiety disorders. There was no statistical evidence showing that the prevalence rates of anxiety disorders were different during pregnancy compared to after childbirth. When looking at each type of anxiety disorder separately, the prevalence estimates were around 2 to 2.5%, except for specific phobias, which had a prevalence rate of about 5%. So in summary, anxiety during the perinatal period is common, with roughly 1 in 5 women meeting diagnostic criteria for an anxiety disorder. And that's a lot of women. The obvious next issue is what can you do to help reduce such anxiety? So in another video, I review research investigating treatments for perinatal anxiety and provide a brief introduction to the more common treatment approaches. But for the moment though, that's it for anxiety disorders during the perinatal period. If there's anything I've gotten wrong, any important research I've overlooked, if you have any questions, then feel free to get in touch. Otherwise, happy parenting.